Because what we want to do is we want to give you some ranges of motion to practice in, to do these exercises that minimizes those sort of adverse, sort of what we call in the clinical world, compensatory movements. We want to avoid that if at all possible. How about you said, I think I heard you say something about tone. Is that correct? How is tone in that left side?
I'm on like a 3-month Botox schedule,
Okay.
and so that helps a lot.
Sure.
But I still have quite a bit of, I don't know what this is called, like 90-degree. So I'm just showing you with my right hand, but like, it gets stiff like this.
Sure.
My fingers are a lot better with Botox,
Okay.
and I've noticed that actually after using the machine, they're pretty relatively soft. Sorry, I have a toddler in the background. If you can.
Quite all right. Quite all right.
Yeah, so I've like tried to kind of play around. I'm relatively new, about a month or so.
Sure.
But sometimes the tone like drags the machine kind of midline, which can be annoying, I guess.
Sure. Sure. Yeah, you're talking about that sort of flexion pattern, really, really common, especially if you're trying very hard. We lose control to kind of dissociate our shoulder, elbow, wrist, and head movements together. That's one of those things that it needs to take some time to work to gain control over those motions again. Because on your right side, you can control your shoulder independent of your elbow, but it's often very hard to do that probably on your left side, where if you intend to move your wrist or your fingers, it's going to kick in both the elbow and the shoulder as well. You get that kind of reflex pattern that emerges again. So that's kind of what you're describing.
Yeah, that's kind of I have a few questions, but my main one all centers around that. Yeah, because everything gets recruited. Like my foot starts going, like I have been told by a lot of therapists in the past, like just mini effort. But it's hard not to recruit those things that are back on, like my bicep and whatnot. So just trying to gauge, I guess, effort, like how hard are you supposed to try, I guess.
Yeah. Now, I think that is a really good question. And so we should frame this and talk about what the end goal is. I think the end goal is, as I described, is being able to control those joints independently. Now, that being said, there is a balancing act, especially early on, when we're trying to get any activation of those joints, of those muscles specifically, and we often find that we get that co-activation across the whole limb. And I think early on, especially if we're trying to just get any activation, that's probably okay. Now, what's kind of nice about the Motus hand is that we can actually use the system itself, because it is kind of isolates, right? It doesn't care necessarily about your shoulder function or your shoulder activation. That's not going to help you play the game. And so we can kind of leverage the fact that it is working on those distal parts of our arm and our hand. Now, specifically speaking, we should be very effortful. I think that's really, really important. But we should also identify the ranges of motion in which we can kind of minimize the bicep and the shoulder kicking in. I think that comes down to how we can work together to identify what those values are. Because what we want to do is we want to give you some ranges of motion to practice in, to do these exercises that minimizes those sort of adverse, sort of what we call in the clinical world, compensatory movements. We want to avoid that if at all possible. Invariably, it's going to happen, but we want to try to minimize it. And what could be happening is you could be working in ranges of motion that are maybe too big to start with, in which case you're trying to move so much that it's forcing you to put that much effort in. So what we can do is we can start off smaller and then work our way larger and larger and larger. Because you can imagine this three-dimensional workspace that a limb can move in. So if it's my hand, I can move in this kind of direction all around, right? But maybe let's say I can move in a smaller range of motion here to here, and that will not cause my elbow to kick in, right? If I try to flex my fingers, it doesn't cause my whole elbow to flex, my shoulder to rotate, et cetera, et cetera. So we just need to figure out what those ranges of motion are for you. The challenge, though, is that it often isn't stationary, because if you get fatigued, If you're really effortful, those ranges of motion can kind of collapse a little bit, and much smaller movements can cause those the shoulder, those elbow movements to kick in. So it's a bit of a balancing act, I'd say, but good question nonetheless. And so I think it's really identifying the ranges of motion that will minimize that from happening while still allowing you to be effortful.